Department.
I have this terrible sense that there's more of it than we would expect to have seen.
We could know by the end of the week whether or not the number of cases of glioblastoma in St. Lucie County are high enough to warrant an investigation. So tonight, Megan McRoberts sat down with two local doctors who were not surprised by what we first uncovered.
In his decades of treating all kinds of cancers, this radiation oncologist, Dr. Mark Perman, has noticed a change.
I've had my suspicions about this for a couple years.
It seems more people are seeking treatment for a deadly form of brain cancer, glioblastoma.
For GBMs, probably around 15 patients per year, maybe 20.
All of them are children-based.
All of them.
He pulled his numbers for the last 3 years through his medical network at South Florida Radiation Oncology, finding nearly 50 glioblastoma cases on the Treasure Coast, 33 of those in St. Lucie County.
Well, I'm not the only provider in the county, so I'm sure that there are some patients who have GBM that I'm not treating.
Neurosurgeon Oscar Centromai works for the Martin Health System, also treating GBM patients.
We do feel like we have a lot of brain tumor cases, if you will, and specifically glioblastoma patients.
He also pulled the diagnosis codes from his hospital network for the last 5 years to see how many cases they've diagnosed.
And that's where we found close to 200 of them over 5 years. And I expect that at least a majority of those will be high-grade astrocytomas. In other words, a glioblastoma.
That number seems higher because Martin Health Systems covers 2 counties, St. Lucie and Martin.
The truth of it is that most people will live maybe a year.
Dr. Perman says treatment options have grown over the years, but the diagnosis still has no cure. Both doctors say genetics can play into the diagnosis.
There's people who are susceptible and others that aren't.
But the environment also plays a role.
Ionizing radiation is one of them. It's known to cause brain tumors.
Now among the many waiting to see if the health department will seek those answers. Now, these doctors tell me it is important to note that the cases they were able to pull for us and contribute numbers for don't necessarily tell the whole story. We spoke with Martin Health System and the South Florida Radiology or Radiation Oncology. We did not hear from Lawnwood or Rollerson and Okeechobee, which would also have separate cases for patients that were treated in their networks. It also would not include patients who were referred out of the area, such as to hospitals in Miami, Tampa, or Orlando. Reporting live, I'm Megan McRoberts, WPTV News Channel 5.
There is now an entire page dedicated to glioblastoma concerns on the St. Lucie County Health Department's website, and it is all thanks to Megan's reports. This site also helps patients get on the Florida Cancer Registry so the state can better track all of these cases. We've put a link to these resources and all of our previous cancer stories in just one place. Go to WPTV.com/glioblastoma.